February 1945. Western Germany lay broken under winter sky, and 3 German Red Cross nurses stood among the wounded, hands raised, white sheets hung from shattered windows. Sister Margret Brenner had been trained in Berlin's finest hospitals. She had survived years of dwindling supplies and impossible choices. She had been told the Americans were ruthless. That capture meant starvation, humiliation, maybe worse. But when the American captain arrived and spoke German, when he asked if her patients needed care, when he sent his own medics to stabilize enemy wounded before securing the building, something impossible happened. Within hours, she would witness medical resources she hadn't seen in 2 years. Real coffee, working equipment, respect between enemies. The propaganda had prepared her for cruelty. It had not prepared her for abundance. And that would change everything. But before we begin, if you want to hear more incredible untold stories from history, hit that subscribe button. And let me know in the comments what city you're watching from. It's fascinating to see how far these stories travel. The schoolhouse near Aachen had stopped being a place of learning sometime in 1943. Now, in February 1945, it was just another temporary structure pressed into service as a field hospital. Its blackboards still faintly visible beneath hasty whitewash, its small wooden desks shoved into corners to make room for rows of metal cots. Sister Margret Brenner moved between those cots with the practiced efficiency of someone who had long ago stopped counting how many wounded men she had tended, how many had lived, how many had not. Her Red Cross armband was faded from repeated washing, her uniform patched at the elbows, her hands chapped raw from the cold and the harsh soap they used to scrub instruments they had already scrubbed a dozen times before. Behind her, Sister Anna Kirchner changed bandages with gentle precision, murmuring reassurances to a boy who could not have been more than 18, his leg shattered below the knee. Sister Lisa Hoffman stood at the supply cabinet, taking inventory of what little remained. 3 vials of morphine, perhaps 2 days' worth of sulfa powder if they were careful. Bandages they had boiled and reused so many times, the fabric had gone gray and thin. The doctors had left the previous night. Margaret had watched them pack their bags with what remained of the valuable supplies, had listened to their reasoning about falling back to regroup, about strategic necessity. She had said nothing because there was nothing to say. The Wehrmacht was retreating. Everyone knew it, even if speaking it aloud remained dangerous. The doctors had ordered the nurses to evacuate with them, to leave the 40 wounded soldiers who could not be moved. Margaret had looked at those men, at their fevered faces and their frightened eyes, and had made a decision that was not really a decision at all. She was a nurse. Nurses stayed. Anna and Lisa had stayed too, though Anna's hands had shaken as she nodded agreement, though Lisa's face had gone carefully blank in the way it did when she was most afraid. The sound of engines reached them before dawn. Not the familiar rattle of German vehicles, but something heavier, steadier, American. The 3 women looked at each other across the dim room, lit only by a few oil lamps. Their dwindling fuel, another problem they had stopped trying to solve. Margaret felt her heart hammering against her ribs, but kept her voice calm. They would hang white sheets from the windows. They would make their Red Cross armbands visible. They would put their hands up and hope that the rules of war still meant something to someone. She pulled the cleanest sheet she could find from the linen closet, its fabric thin enough to see through in places, and tied it to a broomstick. Anna helped her push open the window, the winter air rushing in sharp and bitter. They hung the sheet where it could be seen. Then they waited. The wounded men who were conscious enough to understand watched in silence. Some looked relieved. Others looked terrified. One older sergeant, his chest wrapped in bandages darkened with old blood, closed his eyes and began to pray. The Americans came through the door with weapons raised, young faces tense behind their rifles, their uniforms so much cleaner and better fitted than anything Margaret had seen in months. She stood in the center of the room with her hands raised, her Red Cross armband turned outward, her breath visible in the cold air. Anna stood beside her, trembling but upright. Lieza had positioned herself near the supply cabinet, her hands also raised, her expression carefully neutral. For a long moment, no one moved. Then one of the American soldiers, barely more than a boy himself, lowered his rifle slightly and called something over his shoulder in English. Another soldier entered, older, with a medic's kit strapped to his pack and a red cross on his helmet. He looked around the room, taking in the wounded men on their cots, the three women in their nurses' uniforms, the improvised hospital with its patched walls and insufficient heat. The medic spoke into a radio device clipped to his chest, words Margaret could not understand, then nodded to the soldiers. They lowered their weapons. He approached Margaret slowly, his hands visible and empty, and asked her something in English. She shook her head, helpless. He tried again in halting, accented German. Did any of the patients need immediate medical attention? Were there any critical cases? She felt something crack open in her chest, some tight knot of fear she had been carrying for days or weeks or months. She answered in German, pointing to the boy with the shattered leg, to another man with a chest wound that whistled when he breathed, to a third burning with fever from an infection they had no antibiotics to treat. The medic nodded and spoke into his radio again. Within 20 minutes, an American captain arrived, his German better than the medic's, though still rough around the edges. He introduced himself with his rank and name, asked Margaret hers, then asked about the wounded, not as interrogation but as consultation, as if her professional opinion mattered, as if they were colleagues rather than captor and prisoner. He sent his own medics to assess the German wounded, to start IV lines and administer medications from kits that seemed impossibly well stocked. Margaret watched an American corpsman inject morphine into a man who had been crying softly with pain for 2 days, watched the relief smooth across the soldier's face, and felt tears prick behind her eyes. She blinked them back. There would be time for tears later, or there would not be time at all. The captain explained in his careful German that they would be transported to a processing camp, that the wounded would be evacuated to proper medical facilities, that they would be treated according to the Geneva Convention. Margaret nodded, understanding the words, but not quite believing them. She had heard too many promises break. They were loaded into trucks after the wounded had been stabilized and moved. Anna climbed in first, her face pale. Lieza followed, her jaw set. Margaret went last, carrying nothing but the clothes on her back and the small leather medical journal she had kept tucked in her pocket since 1941. The truck engine rumbled to life and they rolled forward into the unknown, leaving behind the schoolhouse and everything they had thought they understood about what came next. The fever took Anna on the second night. Margaret woke to the sound of her gasping, a wet rasp that spoke of fluid in the lungs, and knew immediately what they were facing. Pneumonia, probably, from weeks of working in unheated buildings and sleeping in damp clothes. Anna's skin burned under Margaret's palm, her eyes glassy and unfocused. In the field hospital with no supplies, this would have been a death sentence served slowly over days. Margaret had watched it happen too many times to count. Young nurses, strong 1 week and gone the next, their bodies simply giving up after pushing too hard, for too long in impossible conditions. Lieza was already awake, her face grim in the darkness of the barracks. She moved to the door without being asked, her knock firm, but not frantic. Margaret expected nothing. Perhaps a guard would come eventually. Perhaps they would be told to wait until morning. Perhaps no one would care that a German prisoner was dying because German prisoners died every day, and why should this one matter? But within 20 minutes, footsteps approached. The door opened. An American military doctor entered carrying a medical kit that looked impossibly large, impossibly full, followed by a nurse with a lantern and an armload of supplies. The doctor knelt beside Anna's cot and began his examination with swift, practiced movements. He pulled a thermometer from his kit. A real one, glass and mercury and intact, not the broken instrument they had been sharing between 40 patients at the field hospital. He checked Anna's breathing, her pulse, her pupil response, his face serious but calm. Then he opened his kit and Margaret saw what abundance looked like. Sulfa drugs in sealed packets, clean IV saline in glass bottles, sterile needles still in their wrappers, bandages white and new. The doctor began mixing medications, explaining as he worked in halting German what he was administering and why. Not because he had to, because he was speaking to another medical professional, and that meant something. He inserted an IV line with efficient precision, hung the saline, administered the sulfa. He left instructions for monitoring fever and breathing, wrote them down on a clean piece of paper, handed them to Margaret, as if her ability to follow them mattered, as if she were a colleague and not a prisoner. He said he would return in the morning to check on the patient. He gathered his kit and left. Margaret sat beside Anna's cot, holding the paper with its careful handwriting, its measured dosages, its assumption that she was competent enough to be trusted with a patient's care. Something in her chest felt too large for her ribs to contain. By morning, Anna's fever had broken slightly. By the third day, she was conscious and asking for water. By the end of the first week, she was well enough to be moved to the camp infirmary for continued observation. Margaret visited her there and found a space that looked nothing like any German military hospital she had worked in since 1943. The infirmary had electric lights that worked. It had heat. It had an X-ray machine that hummed to life when needed, not a broken piece of equipment someone kept promising to fix. It had blood plasma stored in a real refrigerator. It had penicillin, that miracle drug Margaret had only heard whispered about, administered as if it were ordinary rather than impossibly precious. An American nurse named Corporal Klein cared for Anna with brisk efficiency, checking vitals and adjusting medications and offering small kindnesses that seemed unconscious. An extra blanket when Anna shivered, a drink of water before Anna had to ask. Corporal Klein spoke almost no German, and Anna spoke almost no English, but somehow they communicated through gestures and tone, and the universal language of nursing care. Margaret watched Anna begin to relax, watched the constant tension leave her shoulders, watched her stop flinching every time the door opened. On the fourth day in the infirmary, Anna asked Margaret in a whisper why the Americans did not hate them. Margaret had no answer. She had been assigned to work in the camp hospital alongside the American medical staff. Geneva Convention permitted the use of medical prisoners for medical work, and they needed experienced hands. Captain Dr. Thomas Brennan ran the surgical unit with quiet authority, his instructions clear and his expectations high. He was perhaps 40, with tired eyes and steady hands, and he treated Margaret like a surgical nurse because that was what she was. He handed her a pair of rubber gloves on her first day. Real rubber, not the cloth substitutes they had been reusing until they fell apart. He asked about her training. When she told him Charité Hospital in Berlin, he nodded with something that looked like respect. He said he needed someone who could keep up. He said if she could do battlefield medicine with nothing, she could certainly handle a proper surgical suite with actual equipment. They worked on a British prisoner of war with acute appendicitis. The surgery was textbook, the kind of procedure Margaret had done dozens of times, but not in years. Not since the supplies ran out and the equipment broke and everything became about triage and making impossible choices about who might survive and who would not. Here there were proper instruments, sterile fields, anesthesia that worked, sutures that were not repurposed thread, antibiotics to prevent infection. Margaret found herself moving through the surgery with a fluency she had almost forgotten she possessed, anticipating what the doctor would need, her hands remembering rhythms her mind had thought lost. Afterward, Captain Brennan asked to see her medical journal. She hesitated. The journal contained observations, case notes, some careful criticisms of medical policies she had been required to follow, even when she knew they were wrong. But she handed it over because refusing seemed more dangerous than compliance. He read slowly, turning pages with care, his expression unreadable. When he finished, he handed it back and said in his rough German that she was a good nurse, that she had been doing battlefield medicine with nothing, that he did not know how she had kept anyone alive. It was not pity. It was professional recognition. It was being seen as competent rather than complicit, as skilled rather than suspect. Margaret held her journal and felt something she had not felt in years. She felt like a nurse again. The transport arrived on a cold morning in late February, trucks rolling through the camp gates, carrying wounded German soldiers from a field hospital the Americans had just captured. Margaret was working in the surgical prep room when the call came for all available medical staff. She pulled on fresh gloves and moved toward the receiving area with the practiced calm of someone who had triaged hundreds of wounded men and knew how to shut off everything except clinical assessment. Lisa was already there, helping unload stretchers. Anna, recently released from the infirmary, but still assigned to light duty, stood ready with clipboards to document patient information. The wounded came in waves: shrapnel injuries, gunshot wounds, frostbite, infections that had been left too long without proper care. Margaret moved from patient to patient, making rapid decisions about who needed surgery immediately, who could wait, who needed only stabilization and rest. It was familiar work, the kind she could do without thinking, her hands and eyes knowing what to look for even when her mind wanted to drift. Then the stretcher-bearers brought in the last patient, and everything stopped being routine. He was Waffen-SS. The insignia on his torn uniform made that clear even before anyone checked his papers. He was perhaps 32, unconscious, his breathing shallow and rapid. Septic shock, Margaret assessed immediately, her clinical training overriding every other response. Multiple wounds, at least one infected badly enough to poison his blood. Without immediate intervention, he would die within hours, maybe less. Captain Brennan appeared beside her, examined the patient quickly, and gave orders for emergency surgery. He assigned Margaret to assist. Geneva Convention required medical care for all wounded prisoners, regardless of rank or affiliation. The rules were clear. Margaret's hands were not. She stood in the surgical prep room, scrubbing her hands with water that ran hot and clean, something she had once taken for granted and now recognized as luxury. Her hands shook. She had treated SS officers before, in field hospitals where you did not ask questions because questions were dangerous, and the wounded were the wounded. But this was different. This was choosing to save a man who represented everything she had spent years, trying not to see clearly, trying not to think about too directly, because thinking about it meant acknowledging complicity, and complicity meant you were not just a nurse doing her duty, but something much harder to live with. Captain Brennan entered the prep room and saw her standing motionless at the sink. He spoke quietly in his careful German. She did not have to assist if she preferred not to. He could assign someone else. There would be no judgment, no consequences. Margaret looked at him and asked the question that mattered. Would he still treat the patient? Would he still perform the surgery? Still give the same care? Still follow the same protocols he would follow for an American soldier or a British prisoner or anyone else who came through those doors bleeding and dying? Captain Brennan met her eyes and said yes. He had taken an oath. So had she. The oath did not have exceptions for people you hated or feared or whose cause had destroyed everything you loved. The oath was the oath. Margaret dried her hands and entered the surgical suite. They worked for 3 hours removing infected tissue, cleaning wounds, administering antibiotics that the German medical system no longer had insufficient supply. The SS officer survived the surgery. He would spend days in critical recovery, but he would live. Margaret removed her gloves and mask and walked outside into the cold air, her legs unsteady, her stomach churning. She had saved a man who might have sent others to die. She had used precious medical resources on someone who had served a system built on murder. She had followed the rules when following the rules felt like betrayal of everyone who had suffered under the regime she had spent the war serving in her own way. Anna found her sitting on the steps behind the hospital barracks, staring at nothing. Anna asked why she had done it, why she had helped save someone like that. Margaret did not answer immediately. She thought about all the time she had followed orders, because following orders kept you alive. She thought about the small compromises that became large complicity. She thought about what it meant to be a nurse in a system that had decided some lives mattered and others did not. Finally, she said that if they stopped seeing even the worst of them as human, if they decided that some wounded did not deserve care, then they became the thing the propaganda had always claimed their enemies were. They became people who sorted human beings into categories of worthy and unworthy. And she could not do that. She would not do that. Not anymore. Lisa's situation grew more complicated that same week. A new group of German prisoners arrived, among them a former party official who had survived the collapse of the Western Front. He was loud and bitter, still speaking as if the war were not lost, still sorting other prisoners into categories of loyalty and suspicion. He began asking questions about people's backgrounds, their families, their documentation. Lisa recognized the danger immediately. Her papers had been lost during capture. The records that might reveal her Jewish grandmother were scattered or destroyed. But absence of papers also drew attention. She kept her distance from the official, stayed quiet during group meals, volunteered for work details that kept her away from the main prisoner barracks. Corporal Judith Klein intercepted Lisa one afternoon near the laundry facility. She spoke in English, but her meaning was clear from her expression and the gentle firmness with which she steered Lisa away from the path that would have taken her past, where the party official held court with other prisoners. Later, in a quiet corner of the hospital where they both worked, Corporal Klein switched to German. Just a few words. "I know. You are safe here. Be careful who you trust." She did not elaborate. She did not need to. Lisa felt something inside her crack open, some wall she had built to survive, and she wept silently while Corporal Klein stood nearby, not touching, not speaking, just present. That evening, a package arrived for Margaret, forwarded through Red Cross channels. A letter from her late husband's mother, written months ago and only now reaching her through the chaos of collapsing mail systems. Her mother-in-law was ill. The family had lost their home in the bombing. They needed help. They needed her. Margaret read the letter 3 times and then sat holding it, understanding fully for the first time that she had no idea when she would be released, no idea how to reach them, no idea if home even existed anymore, in any form she would recognize. The news came over the camp loudspeakers on the 8th of May, 1945. Germany had surrendered unconditionally. The war in Europe was over. Margaret was in the hospital supply room counting bandages when she heard the announcement, first in English and then repeated in German. The words flat and official and world-ending. She set down the clipboard she had been holding and stood very still. Around the camp, sounds erupted. Cheering from the American barracks. Silence from most of the German prisoner sections. Then, slowly, other sounds. Weeping, praying. Someone singing a hymn in a voice that cracked and faltered. Anna found Margaret still standing in the supply room an hour later. They did not speak. There was nothing to say that would change what had just become real. Everything they had known was gone. The country they had served, however reluctantly or ambivalently, had been defeated utterly. The homes they remembered might not exist. The families they hoped to return to might be scattered or dead or unreachable across new borders drawn by powers that had not consulted them. Anna's village had been destroyed in the final Allied push. That much they had learned from recent transports. Her two brothers were missing, last known to be fighting in Russia, which meant they were almost certainly dead, even if no official notification would ever arrive. The camp administration began processing repatriation papers, but the situation was chaos. Germany no longer existed as a unified state. It had been divided into occupation zones. Prisoners from the Soviet-controlled East faced uncertain futures. Many did not want to return to territories now under Stalin's control, but they had nowhere else to go. Margaret's family home was in the British zone, or what would become the British zone, but travel was restricted, and displaced persons clogged every road and railway. There was no timeline. There were only forms to fill out and waiting lists that grew longer each day. Lies's case was more complicated. Her documentation remained incomplete. Her hometown was in what would become the Soviet sector. She had relatives in Switzerland, distant cousins on her grandmother's side that she had not seen since childhood, but claiming that connection meant revealing the Jewish ancestry she had hidden for years. She sat in the barracks at night, writing letters she was not sure how to send, trying to remember addresses from before the war, before the laws that had made her grandmother's family invisible. 3 weeks after the surrender, the camp command arranged a mandatory viewing. They set up a projector in the largest barracks and required all prisoners to attend. No explanation was given, just orders. The prisoners filed in and sat on benches, confused and wary. The film began. It was footage from the liberation of the concentration camps, Buchenwald, Dachau, Bergen-Belsen. The images were stark and undeniable. Mountains of bodies, survivors who looked like skeletons, mass graves, gas chambers, crematoria. The projectionist's equipment hummed in the silence. No one spoke. Some prisoners turned away. Some covered their faces. Some watched with expressions of frozen horror. Anna made it halfway through before she stumbled outside and vomited in the dirt. Margaret sat rigid, forcing herself to watch, because not watching felt like one more act of cowardice. One more way of saying she had not known when the truth was. She had known something, had suspected more, had chosen not to look too closely, because looking meant facing questions she did not know how to answer. She thought of every patient she had saved, every wound she had cleaned, every life she had fought to preserve, and wondered what it meant to have served a system that had done this. Whether medical care delivered in service to genocide was still mercy, or something much darker. The screening ended. The prisoners filed out in stunned silence. Some insisted it was propaganda, that the Americans had staged it, that it could not be real because nothing could be that monstrous. Others wept. Others simply sat with their faces empty of everything. Herr Vogel, the former schoolteacher who worked in the camp kitchen, spoke quietly to a small group that evening. He said he had heard rumors during the war, whispers about camps in the East, about trains that went one direction and came back empty. He said he had not wanted to believe them because believing them meant admitting what the country had become. He said not believing them had been comfortable. He said comfort had been complicity. Corporal Judith Klein found Margaret sitting alone outside the hospital barracks after midnight, still in her uniform. Her medical journal open on her lap, but the pages empty of new entries. Judith sat down on the step beside her without asking permission. She spoke in quiet German. My grandmother died in the Lodz ghetto, my uncle in Treblinka. I got out in 1938 with my parents and younger sister. We were the lucky ones. We had a sponsor, a physician in New York who helped with the visa. Most of my family stayed. Most of them are gone now. Margaret could not make herself speak. Judith continued. You did not do that. You are a nurse. You saved lives. That still matters. Margaret finally found words. Barely a whisper. Does it? Does it matter if the lives I saved went back to serve that system? If the soldiers I kept alive went on to kill more people? If every act of mercy I performed made me part of the machine? Judith was quiet for a long time. Then she said that she did not have an answer that would make it easy. That probably there was no answer that would make it easy. But that the alternative was to say, medical care itself did not matter, that nurses should have let everyone die, that mercy was meaningless. And she could not believe that. She had to believe that caring for the wounded, even enemy wounded, even wounded who had done terrible things or served terrible causes, was still an act of basic humanity. Because if that was not true, then everything was lost. Margaret went back to her barracks and burned her medical journal in the small stove they used for heat. She did not burn it in anger. She burned it because every page felt tainted now. Every careful note and observation and record of lives saved felt like evidence of collaboration. Anna watched her feed the pages into the fire one by one and said nothing. Liesa sat on her cot writing another letter to relatives who might not exist at addresses she could barely remember. The three of them had reached the bottom. There was nowhere lower to fall. Captain Brennan found Margaret in the hospital supply room 3 days after she had burned her journal. She was organizing bandages with mechanical precision, her hands moving through familiar motions while her mind existed somewhere far away. He set a folder down on the counter beside her and waited until she looked up. He spoke in his careful German. The military was contracting civilian medical personnel for the displaced persons camps. Experienced nurses were desperately needed. Typhus and dysentery were killing people faster than the doctors could treat them. The pay would be minimal, but regular. Room and board provided. Civilian status, not prisoner. Supervised work, but meaningful work. Was she interested? Margaret stared at the folder. I am a prisoner of war, he nodded. You are also a nurse. And people are dying of preventable diseases because we do not have enough medical staff who know field sanitation and epidemic control. Your status can be adjusted for humanitarian work release under supervision. It has been done before. She asked why he would recommend her, why he would trust her after everything. He said because he had watched her work for months, because she knew how to keep people alive with almost nothing, because he thought she needed a reason to keep going, and medicine was the only reason that made sense anymore. She took the folder. She read through it that night in the barracks, while Anna slept fitfully, and Lisa wrote another letter by dim lamplight. The next morning she told Captain Brennan, yes. Lisa agreed to the same offer. Anna hesitated for 2 days before saying she would try, though she was not sure she had anything left to give. They were processed out of prisoner status into supervised civilian contractors within a week. The change was mostly paperwork, but it felt like being given back a piece of themselves they had thought permanently lost. The displaced persons camp near Munich was chaos made visible. Thousands of people crammed into temporary barracks, multiple languages, multiple nationalities. Everyone, displaced by war and unable to go home for reasons that range from destroyed cities to changed borders to political persecution. The medical facilities were overwhelmed. 2 doctors and a handful of nurses trying to care for populations that included elderly people, pregnant women, small children, and adults weak from malnutrition and trauma. Margaret arrived, and within an hour was treating a child with severe dehydration, her hands remembering protocols, her voice steady as she explained to the mother through a translator how to continue oral rehydration after the initial IV treatment. She worked 18-hour days because the work never stopped. She taught younger nurses, a mixed group of German and Polish and Jewish women, basic field sanitation techniques. How to recognize early signs of typhus, how to set up proper waste disposal to prevent epidemic spread, how to stretch limited medical supplies through careful rationing and creative reuse. She used techniques she had learned from Captain Brennan and techniques she had developed during the worst days at the field hospitals, combining them into something that worked in this new context of peacetime crisis. Slowly, Over weeks and then months, she began to feel like a nurse again, not a servant of the Reich, not a collaborator in something monstrous, just a person who knew how to keep other people alive and was doing it. Anna found her calling working with the orphaned children who flooded the DP camps, children who had lost parents to bombing or disease or concentration camps, children who spoke languages Anna did not understand, but whose fear and grief needed no translation. She learned to be gentle with them in ways she had not known she possessed, sitting with them during nightmares, teaching them simple games, making sure they ate even when they insisted they were not hungry. One afternoon, a little girl, perhaps 5 years old, called her Mutti by accident, mother, the word she had been searching for. Anna excused herself and wept in the latrine for an hour. Then she washed her face and went back to work. Lisa's letter to Switzerland was answered in July. Distant cousins remembered her grandmother. They could sponsor her immigration. The paperwork would take time, but it could be done. Lisa began the long process of documentation, of proving who she was and where she came from when half the records had been destroyed and the other half were scattered across a divided country. Before she left the Munich area, she traveled back to the former POW camp, now transitioning to other uses, to find Corporal Judith Klein. Judith was processing out, returning to the States, her service complete. They met in the administrative building and stood facing each other. Two women who had been nurse and prisoner, and then something closer to colleagues. They embraced without words. Lisa whispered, "Thank you," in English. Judith held her tighter and said, "Stay safe," in German. Some connections endured beyond language or circumstance or the roles that war had forced them into. In December of 1946, Margaret received a letter forwarded through multiple addresses. It was from Captain Brennan, now Dr. Brennan again, returned to civilian practice in Ohio. The letter was formal and kind. He wrote that he did not know if she would remember him. They had worked together briefly during difficult circumstances. He wanted her to know that the work she had done mattered, that saving lives when it was hard to see the point was the most difficult kind of courage, that he hoped she had found peace in whatever form peace took after everything, and that if she ever made it to the United States, his practice could always use a surgical nurse with her level of training and experience. It was an opening, not a promise. A door left unlocked. Margaret sat in the small room she shared with Anna near the DP camp, the letter in her hands, and felt something like hope stir for the first time in months. Anna asked what the letter said. Margaret read portions aloud, translating the English slowly. Anna asked if she would go, if she would try to emigrate to America. Margaret said she did not know. There was still family in Germany, still work here that needed doing, still a country that had to be rebuilt by someone. But maybe someday, maybe when things were more stable, maybe when she could believe again that building something new was possible. Anna received her own impossible letter in the spring of 1947. Her younger brother was alive. He had survived Soviet captivity and was being repatriated through the Red Cross. She read the letter 3 times, her hands shaking so badly she could barely hold the paper. Then she collapsed on her cot and sobbed with a relief so overwhelming it felt like drowning. Margaret held her while she cried. When Anna could breathe again, she began writing back immediately. Her brother would need help reintegrating. He would need family. She had become someone who knew how to help people survive impossible things. She would help him survive this. By 1948, Margaret was training a new generation of German nurses at a civilian hospital in Frankfurt. Young women who had been children during the war, who were coming of age in a shattered country that needed to be rebuilt from rubble and shame. She taught them field medicine and surgical protocols. She taught them that medicine had rules, and those rules mattered. She taught them that every patient deserved care regardless of who they were or what they had done, because the moment you started sorting people into categories of worthy and unworthy was the moment you stopped being a healer. She did not tell them about the camps or the SS officer or the medical journal she had burned. She just taught them to be better than what had come before. One morning in the hospital supply room, surrounded by shelves stocked with proper medical supplies purchased, through proper channels in a country slowly learning how to function again, Margaret picked up a pair of surgical gloves. Real rubber, not reused, not patched. She thought about the first time Captain Brennan had handed her gloves like these, about the abundance that had seemed impossible, about how mercy looked when backed by resources and rules. She thought about what she had learned in that POW camp. That restraint was not weakness. That following protocols even when it was hard was what separated medicine from brutality. That sometimes the enemy showed you how to be human again when you had forgotten what that looked like. She pulled on the gloves and walked toward the surgical suite. There was work to do. There was always work to do. But now, the work was building something new instead of serving something monstrous, and that made all the difference. The war had taught her what she was capable of enduring. The peace was teaching her what she was capable of becoming. And in the space between those two lessons, she had found something that felt almost like redemption. Not forgetting, not erasing, just choosing differently, every single day, one patient at a time.